large bodies they are present, transversely they are more wider than the ventral posterior, look like a kidney, and the central part having a features, and they have the articular facets, superior and inferior articular facets. They have additional projections on the superior articular facets, we call them as mammary body. They are bulkier in the lower part because they have a more bulky muscles attached to it, as they are bearing more weight, so they have to be bulkier as they are going down. And related to this particular canal or this vertebral foramen, the lumen diameter matters because spinal cord runs through them. So, we have to identify the vertebral canal or vertebral foramen through which the spinal cord comes out, and intervertebral foramen. So, what do you mean by the intervertebral foramen? What runs through the intervertebral foramen? Several times I have mentioned it. So, run about this particular vertebral canal, vertebral foramen, intervertebral foramen, what comes through it. Learn about this particular thing, we call them as like the intervertebral discs. We have this particular intervertebral disc placed between them. We have got two parts of the intervertebral disc, Nucleus pulposus and Annulus fibrosus. They are coming from different sources, and these things have importance for the clinical part, because the disc prolapse, which is maybe bulging out of the disc, may happen and compress the spinal cord or the nerves which are exiting out of this particular intervertebral foramens. They are very important for identifications. Rest of the things, anatomically this particular vertebra have got like the holding this particular spinal cord. The spinal cord will be learning that in like a central nervous system classes. So, this particular spinal cord having a covering, we call them as meninges. They are covering sleeves around the spinal cords, they are running throughout it. So, to access this particular meninges which holds a fluid in it, we call them as like a cerebrospinal fluid. We have to do a procedure, we call them a spinal tap. Between this particular spinal vertebrae, we have to go and reach to that particular space to do a procedure, we call them as like a spinal tapping. So, whenever you are going to talk about this particular spinal cord and the details of the spinal cord, we will talk about that particular thing. For now, we are just restricting this part about the simple form of identifying it. So, you should be able to identify these different types of vertebra, three of them, cervical, thoracic and lumbar. How to separate between them in easy words like the basic features, and rest of the features will be followed on like the body is heavier or transverse or small or lumen narrower, but the basic identifying feature is the transverse foramen, costal facets, and not having any of them in the lumbar vertebrae. So, two of the features is present in special vertebrae, one do not have any features whatsoever, identifying them, and this rest of the things we are already have mentioned about it. So, these are the things related to this particular other vertebra, we call them as 7 cervical vertebra. We have 7 cervical vertebrae, so 1, 2, 3, 4, 5, 6, 7. The 7th one we call them as C7. The C7 have got like an elongated spinous process, which is just like thoracic. So, if you just like roll down your finger back side, you will find that the prominent part of this particular spine ends in it. So, where you see that particular most prominent part here, that is a C7 spinous process you are touching, that is very prominent, rather the prominent vertebra that you are touching in the back side, which is prominent one in any and every individual. So, that spinous process makes this particular prominent amongst this thoracic cervical vertebrae. Rest of the spinal vertebra blunt and bifid, as I have mentioned. And other than this, they have this particular cervical vertebra are same. So, you have to know this particular cervical vertebrae and the joints they are present in between. So, they are having joints which is present in the vertebrae between this the secondary cartilaginous joint between these bodies and this particular facet joint which is synovial joint. We call them as like zygopophyseal joints which is present on the right side and left side between the superior and inferior articular facets. They are covered with the synovial membrane, movement can be allowed in it. And apart from that, between the C1, C2 and the occipital bone, we have a special kind of joint. We call them as atlanto-occipital joints or atlanto-axial joints. We will talk about that particular joint in detail because they are short note exam questions that we have to know, right. So, for this knowledge is good for us to identify. Now, next move to this particular like the organ that we are left with. We did not learn this particular organ really well or may have learned, but just like a quick recap on this particular the female reproductive organ. So, we have this particular female reproductive organ with us and the viscera. So, we have this particular female reproductive organ which is consisting of in this specimen is that we have the uterus, right, and the lower end of the uterus which is known as the cervix, and this part we call them as like a ovary, right, and joining between them we have this particular tiny tube, we call them as uterine tube. So this particular uterine tube and ovary, which is like presented on the back side, so they are kind of like a back side. So this is the posterior side, easy to identify, they are present on the posterior extreme. So this uterus is anchored to this particular side, the ovary is anchored to the sides of this particular uterus, so that this ovary do not escape by a ligament, we call them as ovarian ligament. And from the ovary again we have a membranous ligament is there, we call them as suspensory ligament of ovary, which is falling on the lateral pelvic wall. So there are two elements about the ligaments of the ovary, one is ovarian ligament, other is suspensory ligament of ovary. Suspensory ligament of ovary is a kind of like a membranous flap, that means it is a kind of like a peritoneal fold, and this one is a kind of developmental remnant. We learn about developmental remnant, we call them as gubernaculum, which is related to this the descent of the testes or gonads over there. In case of the gubernaculum we call them as like a gubernaculum of ovary. In case of the testes we call them as gubernaculum of testis. So this particular embryological remnant shrinks in size and helps this particular descent of the gonads from the lumbar to this pelvic region or the pelvic region to the scrotum region, depending on how much it is shrinking. In case of the female subject, part of this gubernaculum forms this particular ligament, we call them as ovarian ligament. Ovarian ligament is holding this particular ovary with the sides of the uterus. Now uterus have got three parts, upper part, middle part and the lower part. Upper part we call them as the fundus, then we have body, then we have cervix. How much is fundus? See the opening of this fallopian tube, right side, left side. So you join this particular fallopian tube with a straight line. Above the part of this female reproductive organ with the uterus you have, we call them as fundus. So you join the line, so right side and left side fallopian tube, the tissue which is above that joining line we call them as fundus. Fundus don't have any cavity. Then we have this body of the uterus which has a cavity, we call them as uterine cavity. Uterine cavity is continued down to the cavity of the lower part of the uterus, we call them as cervix. So we call them as cervical canal. So it is circular. This uterine cavity is V-shaped, then it becomes tapered, becomes circular. So as because it is circular we call them as canal. So this particular circular canal which is ending outside in here we call them as os. There are two os are there, O or S. We call them as external os, we call them as internal os. So how to collect them? So we have this particular canal which is fanning out, for example like this. So this is the uterine cavity for example, then we have the cervical canal, and then cervical canal continued down to this particular element we call them as vaginal canal, right. So this particular extreme of the cervix have got two connections which has a communications of the cervix which is going to the uterine cavity, we call them as internal os, and the external os which is communicating with the cervical canal with the vaginal canal. So these are two os are there, between these two os is stretched that the cervix or cervical canal. So cervix is having two doors, one door is communicating with the vagina, one door is communicating with the body of the uterus. So that particular two doors or 2 points where these things communicating above and down we call them as os. So one os is externally communicating with this vagina, we call them as external os, which is can be accessed whenever you are going to do examination. So from external side if you are going to examine the subject we can see this external os, but internal os is too deep inside, we cannot see that, we have to do something special to see that again. So that particular internal os is inside this which is joining this particular cervical canal with this particular cavity of the uterus, right. So these are the things that you have to keep in mind. What do you mean by the os, what do you mean by the internal os, what do you mean by the external os, between internal os and external os stretched between the cervical canal. Now other than this we have this particular uterus with the fallopian tube held in positions, easy to identify the positions of the ovary and fallopian tube which had to be placed backside. Now other than this we have a ligament, so which is known as the round ligament. So this round ligament helps us to identify. Likewise we talked about the ovarian ligament which is present on the back side, this is the ovarian ligament and this is the round ligament. In examination they ask about round ligament, they ask about this particular ovarian ligament. So what do you mean by the round ligament, what do you mean by the ovarian ligament? The round ligament and the ovarian ligament, they are coming from the same derivative. We call them as gubernaculum of ovary. A part forms this round ligament, a part forms this particular ovarian ligament. So, this stretch which forms this particular like a ligament, we call them as ovarian ligament, then it stretches from front side, becomes round ligament and goes to this particular deep inguinal ring, inguinal canal, superficial ring and split into small fragments. So, this round ligament and this ovarian ligament, they are from the same extreme, they are coming from the gubernaculum ovary. A part becomes round ligament pressed in the front side, a part becomes ovarian ligament present in the back side. And the fate of this particular round ligament, they are running through this particular inguinal canal. In case of the male subject, we see that it is running through the inguinal canal is the spermatic cord and the contents of it, right. In case of the female, this round ligament which is present. So, this round ligament is this one, right side is visible, left side is this one, tiny one, right. So, this round ligament is on the anterior side and resting is back side. So, easy to identify in the examination, do not get confused. Find the ovary where the ovaries are. Ovaries are on the back side, fallopian tubes are on the back side, round ovarian ligament is on the back side. So, these three structures on the back side, only front structure is the round ligament. So, easy to identify this way. If you cannot identify them, just identify the ovary. So, place the ovary on the back side. So, this is the posterior surface, this is the anterior surface, fundus, body, cervix. Now, this particular thing has a bend. So, naturally these things are bending. So, this particular uterus having a curvature, we call them antiflexion, antiversion. So, there are two flexions and big bends are there. So, antiversion means there are bend between this particular vaginal tract with the cervix tract, and antiflexion is that between this particular body of the uterus and the cervix, they are having a bend. So, we call them as antiflexion, which is an angle between the uterus body and the cervix, and the antiversion is the angle which is between the cervix and the vagina. So, antiflexion and antiversion, that means it is not staying straight, this is bending forward. So, whenever you are holding that, you have to just like a carve it down with the thumbs, you have to press it down, just like you do not have to press it so that you are going to crack it, but thing is that you are trying to integrate making a bend like this. So, upper part should be bending like this and dropping like this. So, if the uterus is remaining straight like this becomes straight with the vaginal tract, that makes this particular uterus vulnerable for dropping down, we call them as prolapse. So, this particular natural angulation that is present between this particular antiflexion and antiversion helps this uterus to stay in position during this particular pressure building side. When the pressure builds, like whenever you're coughing, sneezing or in defecating, there is a increase in the intra-abdominal pressure. If you have increased intra-abdominal pressure, this will be pushing down. So, then will be slipping down to the vaginal tract, eventually may be coming out. So, that particular thing is kept in a position like this. So, this particular whenever this particular intra-abdominal pressure is there, it is pressing on this structure which is lying in front of it. What structure lying in front of it? Urinary bladder. So, in the urinary bladder you have seen that the superior surface of the urinary bladder is there. So, superior surface of the urinary bladder, this is resting on and pressing on the urinary bladder, so that it bypasses by the vector law the weight which is put on it with this increased abdominal pressure. How these particular things are kept in place? Because of this particular tension of this particular round ligament which is having around that, you have a supports of the uterus which is having a pelvic floor which is present, the organs which is nearby which is also helping these things out, and antiflexion, antiversions, and this particular ligament which is known as McIndore's ligament, transverse cervical ligament, which are holding this in positions on this region. So, active support and the passive supports which are basically keeping this particular uterus in positions whenever you are having this. Now, coming to the blood supply of the uterus, is having a blood supply which is coming from uterine artery. That is not the only source of the uterine artery. The ovarian artery, anastomosis between the branches of ovarian artery and the uterine artery supplies this uterus and as well as the ovary. So, ovary is supplied with the two sources, branches of the uterine artery, branches of ovarian artery, and likewise the ovarian artery is supplying this particular uterus as well. So, it is supplied by the uterine artery which is for example 90% contributions to it. Ovarian arteries also contributes to the sides of it like a parametrium. They are covered by this particular peritoneal fold, we call them as broad ligament. They have two layers are there. Subdivisions of the broad ligament are there, meso-ovarian, mesobarium. They have mesosalpinx, they have content on a broad ligament, anterior to posterior, you have to remember that. Now, you remember the sequence of the remembering these things, anterior, posterior, this broad ligament on the side, there are three structure. Most anterior, what structure is attached on the most anterior to the uterus? round ligament, then round ligament, then uterine tube. So round ligament, uterine tube, ovarian ligament. So these are the three structures anterior to posterior. They have been asked in examination. These are the relationship of the structures. How the blood vessels are coming to the ovary. This is the ovary, right? So this is the round ligament, ovarian ligament. This is the ovary. How the ovary reaching this blood supply to it? From the sides. So this is known as, which is falling on the the peritoneal fold which is coming on the sides of the lateral wall, we call them as suspensory ligament of ovaries. That through the suspensory ligament of ovary the blood vessel comes in. What blood vessel supplies the ovary? Yes, but blood vessel which is coming in here is ovarian artery. Uterine artery is the branch of which artery? Anterior branch of internal iliac. So they are coming from below. They are entering the broad ligament from below, from the sides of the uterus they are coming, and they are going on the sides of the uterus and then splitting into branches and joining this. So this particular element of this you have to know. Related to this organ which is on the back side, what structure lying on the posterior surface of the uterus? Rectum, right? In the probe. Anterior to it? Bladder. In between the peritoneal folds? Recto, uterine pouch, uterovesical pouch. There are two peritoneal folds are there and holds like whatever the important landmarks that you have to know. So this is what you have to keep in mind related to it. Now you see that this is a split of this particular structure that you are seeing. Now you see the cavity of the uterus and cavity of the fallopian tube and everything is visible. So this is the cavity of pear-shaped structure which is having the cavity, which call them as uterine cavity, which is going into this particular cavity into it, we call them as cervical canal. This point where it is meeting here, we call them as internal os. This point we call them as external os. This is the fallopian tube piercing into right side and left side. So this is the meeting point of this particular fallopian tube right and left with this particular cavity of the uterus. This have got three layers outside to inside. They are known as perimetrium, myometrium, endometrium. So endometrium is that inner mucosal lining. This particular mucosal lining goes on cyclical changes for this particular hormonal changes which is taking place during the menstrual periods. So this particular element is, if you cut this particular structures like this, they look like this. So this is a cervix. This part of the cervix which is making out here looks like a lip. We call them as cervical lips. So these are two cervical lips. Down here will be vagina. Anterior wall of the vagina, posterior wall of the vagina. They are ending in the blind pouch like this. They call up fornix. There are two fornix are there. On these sides we call them as lateral fornix. Anterior and posterior, there are two fornix are there. So these lateral fornix and this anterior and posterior fornix, they are encircling it like this tube. So if you fit a tube like this, they are this vagina. Then the vagina makes a cavity like this. We call them a fornix. Anterior fornix, posterior fornix, on the side lateral fornix. Right. So this particular element are structures that we are seeing this particular things. Again, whenever you are having this particular organ to identify it, anterior and posterior need to be identified. Easy to identify by ovary attached with this ovarian ligament. This will be back side and this will be front side. Easy to hide. Round ligament will be on the front side. So these are the round ligament cut here. So this particular round ligament has to cut to expose this. And this sides through here blood vessel enters here. Uterine artery comes from below. So they come here and split into branches. Anterior division, posterior divisions like this. They come here like this and supply this fallopian tube and this particular ovary. So fallopian tube also have got like parts. We know that fallopian tube parts. What are the parts? 4 parts are there. Ampulla. Alright, so medial to lateral you have to state like what are the parts, and most widest part is ampulla where this particular fertilization takes place, and this ampulla is a dilated part or most dilated part. If this particular fertilization takes place and sits there, we have this particular ampullary pregnancy, we call them as ectopic pregnancy. That particular pregnancy is dangerous. It can like burst open this fallopian tube or the cavity of that particular fallopian tube. So these are the things that you have to keep in mind related to it. দেখে নাও, বই খোলো, ছবি দেখো, দেখে নাও, কোনো ডিফারেন্স নেই, সহজতম জিনিস এটা। এবারে বইগুলো খোলো, খুলে এসে দেখো।